Are you tired of that persistent ache slowing you down? Is lower back pain keeping you from enjoying life to the fullest? Well, you're not alone. Lower back pain affects millions worldwide, disrupting daily routines and stealing away precious moments. In this video, I'm going to tell you about back pain, its causes, its risk factors, how to diagnose it, and its remedies. Number 1. Common issue. Back pain is one of the most common reasons for seeking emergency care and has a broad range of potential causes. About 23% of the world's adults suffer from chronic low back pain. People over 30 years are more prone to back pain as intervertebral discs wear away with age. Overweight or obese individuals are more likely to experience back pain due to extra pressure on joints and discs. Weakened abdominal muscles can lead to strains and sprains. Smoking, excessive alcohol, and a sedentary lifestyle increase the risk. Jobs involving heavy lifting or bending increase the risk of back injury. Conditions like scoliosis can cause severe back pain by changing spine alignment. Family history of osteoarthritis, certain cancers, and other diseases elevate the risk of low back pain. Depression and anxiety can contribute to back pain. Number 2. Symptoms of lower back pain. Pain may be sudden or gradual, sharp or dull. Pain might radiate to legs, especially in sciatica cases. Movement and posture can be affected, such as standing crooked or bent. Decreased range of motion. Acute pain lasts suddenly. Chronic pain persists over 3 months. Seek medical attention for back pain after an injury, leg weakness, fever, or other symptoms. Number 3. Causes of back pain. Lower back pain can be caused by tight hamstrings, strains and sprains due to improper lifting, sneezing, coughing, or bending. Fracture, arthritis, diseases, spine tumors, infections, and other diseases can lead to back pain. Spondylolisthesis occupation. Jobs involving lifting, pulling, or twisting can contribute to back pain. Number 4. Treatment modalities. First step. Home care. Home care involves using simple methods like applying heat with a heating pad and avoiding prolonged bed rest to manage back pain caused by muscle strain. Applying heat can relax tense muscles and improve blood circulation, promoting healing. Avoiding excessive bed rest helps maintain muscle tone and flexibility, preventing further strain on the back. Returning to normal activity can prevent deconditioning and alleviate muscle stiffness. Second, stretching. Specific stretches, especially those targeting tight hamstrings, aim to lengthen and reduce tension in the hamstring muscles. This, in turn, relieves stress on ligaments and discs in the lower back. Focus on hamstring stretches to reduce tension in the lower back. Stretching helps improve flexibility, reduce muscle tightness, and promote better alignment of the spine. By relieving tension on supporting structures, stretches can lead to decreased pain and improved mobility. Third, yoga. Yoga involves gentle movements, stretches, and poses that enhance flexibility, strengthen core muscles, and improve overall body alignment. Can aid back pain, but expert guidance is crucial. Yoga helps increase flexibility, strengthen muscles, and improve posture. It also promotes relaxation and stress reduction, which can indirectly alleviate tension-related back pain. Fourth, spinal manipulation. Chiropractors and orthopedic surgeons use controlled force to adjust misaligned joints in the spine, aiming to improve mobility and reduce pain. Spinal manipulation can provide immediate pain relief and restore proper spinal alignment. It may also enhance nerve function and blood flow, promoting healing and reducing muscle spasms. Fifth, massage. Massage involves applying pressure and kneading techniques to soft tissues, promoting relaxation, improving blood circulation, and reducing muscle tension. Combined with exercise, it can provide relief. Massage can help release muscle knots, improve flexibility, and increase blood flow to the affected area. It also triggers the release of endorphins, natural pain-relieving chemicals, leading to temporary pain reduction and improved overall well-being. Sixth, medications. Over-the-counter pain relievers, like acetaminophen, ibuprofen, and prescription medications can reduce pain and inflammation in the lower back. Medications provide temporary relief from pain and discomfort. They can improve your ability to perform stretches and exercises, making it easier to engage in activities that promote long-term healing. Seventh, surgery. Surgical interventions address underlying structural issues causing chronic back pain, such as herniated discs or spinal stenosis. Surgery can provide definitive solutions for specific conditions that don't respond to other treatments. It aims to correct the root cause of pain and restore normal spine function, offering lasting relief and improved quality of life. 8th, physical therapy. Physical therapists design personalized exercise and stretching programs to strengthen muscles, improve flexibility, and promote proper body mechanics. Strengthen muscles and improve flexibility under professional guidance. Physical therapy addresses muscle imbalances and weaknesses that contribute to back pain. It provides targeted exercises to enhance core stability, correct posture, and build strength, leading to improved overall back health. 9th, strengthening exercises. These exercises target specific muscle groups, such as the muscles that support the spine, to improve stability and prevent further strain. Flexion and extension exercises to strengthen back muscles. Strengthening exercises improve muscle tone, enhance spinal support, and promote proper movement patterns. Number 5, preventing lower back pain. Maintaining a healthy weight, regular exercise, proper lifting techniques, ergonomic adjustments, and maintaining good posture are preventive measures to reduce the likelihood of future back pain. These strategies promote overall musculoskeletal health, reduce stress on the spine, and minimize the risk of developing new or recurring back pain. By adopting healthy habits, individuals can enjoy greater comfort and mobility in their daily lives. Remember, individual experiences may vary, and it's important to consult with a healthcare professional before starting any new treatment or exercise regimen, especially if you have underlying health conditions or severe back pain. In conclusion, understanding and effectively managing lower back pain is a journey that empowers individuals to regain control over their lives. Throughout this comprehensive guide, we have explored the intricate web of causes, risk factors, symptoms, and remedies associated with lower back pain. This knowledge equips us with the tools to address this pervasive issue head-on and pave the way for a pain-free, active lifestyle. Moreover, the diverse range of treatment modalities discussed here offers a personalized approach to managing and alleviating lower back pain. Whether through home care practices, targeted stretches, yoga, spinal manipulation, or medical interventions, each option addresses specific facets of the condition, targeting pain relief, improved mobility, and long-term healing. If you found this video helpful, make sure to like this video right now, subscribe to this channel, and hit that bell button for more tips on back pain support. Thanks for watching, and see you in the next video.